Hello and welcome once again. Again, this is your instructor, Mr. Reyes. We'll continue our conversation on Chapter 1, Intro to the Role of the Nurse Assistant. Now, we've discussed several topics throughout this edition of the videos, and today, right now, we'll be speaking about the different policies and procedures that you also need to be aware of as it relates to your new job. Okay, so first of all, what is a policy and what is a procedure? In businesses, when you are hired for a certain job, you will be given a list of policies. In other words, a list of rules. For example, there may be different rules as far as your attire. Should you be wearing your uniform at every time you come into work? Do you need to wear a name tag to identify yourself? Do you about your appearance, right? Are you allowed to wear maybe piercings or earrings if you're a male, or can you wear long acrylic nails if you're a female? So there's policies about your appearance, your attire, your behavioral, and of course your professionalism, and we'll talk about that in just a minute. So you need to be aware that there are these such policies that you must follow, and we'll go into specific ones that apply to a nursing or healthcare profession. A procedure now, the difference between a policy and procedure are very different. A procedure is a process. For example, if you are instructed to perform a task such as assisting a resident with personal care, for example, brushing their teeth, you need to follow a procedure, right? You need to follow steps. Therefore, you must follow the procedures with every task that you perform during personal care or any other part of your job. So make sure you are aware of the policies that are in place as far as your attire, your appearance, and so on, and of course the procedures that you need to be aware of. Some other policies that are very, very important that you need to be aware of is resident information. As you know, there is a law by the name of HIPAA, or Health Insurance Portability and Accountability Act. Now, this law was passed back in 1986, and what it is that before, a lot of information was being divulged or given to people that had no reason to have personal information, such as your name, your address, your insurance information, etc. So while this was happening, it was discovered that a lot of people were committing fraud. Therefore, this law was put in place to protect the privacy of residents and patients in healthcare. So you must be aware that this law is a federal law and has severe and serious consequences if it is violated. So in every job in healthcare that you'll be hired for, you are going to be informed about HIPAA or HIPAA and the private resident's privacy or patient confidentiality, as it is referred to at times. So again, please make sure that you are aware of the patient privacy policy. The residence care plans. What is a care plan? This is something that sometimes we forget to what it is and what's in it. So what is a care plan? Well, a care plan is, as the name kind of implies, right? It's a plan, okay, that we have to follow, all right? If we want patient A to improve, to eventually get better and go home, then we must have a plan in place. We can't just do it on the go or on the fly, or just do whatever we think is best. Sometimes that does not give you the outcomes, right, or results that you want. So we have a plan, right? And of course, it's a plan, the care, right? The care is what we provide, and the plan is in place. So the physician tells us in general, this is what I would like my resident to have if he's in agreement. And we, as a healthcare team member, including all the ones that we discussed in the previous video, the therapists, the nurses, the nurse aides, social workers, dietitians, everybody has to chip in and do their job. We are all working towards the same goals for this resident, of course, is to get better. So again, familiarize yourself with a care plan. Every resident has a different care plan. It's not one fits all. So please make sure you treat each resident individually, as an individual, and of course according to their needs. Another policy that we need to be aware of, okay, is that you need to follow or perform the tasks that are on your job description. As we mentioned before, working outside your scope of practice can lead you to serious consequences. Again, we all answer to a supervisor, and you as a nurse assistant will have to communicate to your nurses, your immediate supervisor. We talked about the chain of command in the previous video. Now is the time to apply it. If you see a problem, a patient gives you a problem or says he's having pain, that is not in your job description to help him with, but you can take that problem and give it to the nurse. Communication, right? Relay the problem to the nurse. Report, right? Remember, observation and reporting is key, very important. Again, you should not discuss your personal problems. It is very important, but it's also very easy. At times you will feel like you are attached to the residents as a family member, but please make sure that you do not violate this. Sharing your personal problems, your personal information can only lead to other problems that you may not want. You should not accept ever any gifts or money. This is a policy, right? Why? Because many times it be misconstrued, misunderstood, or misinterpreted, right? As a gift, someone may accuse you of stealing when in reality someone gifted it. So as a general rule of thumb, we do not accept any money or gifts from residents. We do not want them to expect something in return or favorable treatment because they gave you a gift. So to avoid those misinterpretations, we typically do not accept gifts or any sort of monies from them. Okay. Another important policy that I really adhere to is being dependable. In healthcare, there is a chronic problem with people that are not dependable. Either they show up late to work or don't show up at all, or they call in too frequently. Many times you will find yourself feeling frustrated and tired, maybe mentally fatigued. Then you need to go to your supervisor and explain to them what you're going through. It is nothing wrong. We all have a limit and we must recognize that limit. Communicate with your supervisors and tell them what you're experiencing. There is nothing wrong with getting fatigued physically and mentally, especially when you deal with residents that have dementia, which we'll talk about in later chapters. All right, so make sure you communicate with your residents. As a CNA, you must have certain characteristics. Okay, not everybody is cut out to work in healthcare, and that's fine. Okay, but if you are considering working in this field, you must have at least some characteristics, including being professional. Now, being professional doesn't mean you have a high degree. All it means is that you are separating your personal life from the work area. Okay, so every time you walk in through those doors in your job, you must leave your personal life behind, including your problems, right? Your difficulties, your challenges. Do not bring them to the residents. They do not need to hear more problems. Remember, they are there because they have problems. So the last thing they need is to hear yours. So please keep your personal life separate from professional, even if you find it difficult at times. Of course, we're all compassionate. Now, compassionate doesn't mean that you have to be sitting next to a resident or a patient 24 hours a day. Being compassionate, all it means is showing concern. Okay? If you have a family member that was perhaps hospitalized for whatever reason, if you pick up that telephone, give them a phone call and ask them, how are you doing? I was thinking about you. That is being compassionate. You are showing concern. In the work area, if you take that extra minute to do a little something for the resident that is in the care plan, then you are showing compassion. Okay, you're taking a little bit, demonstrating concern, not just saying it but actually doing it. So that's even better. Being empathetic means putting yourself in their shoes. If you were that resident in that situation with those medical problems, how would you like to be treated? Remember the golden rule, right? Treat others as you like them to do unto you. Okay? Do unto others as you like them to do unto you. So please remember that. Or your family member. So treat them with the utmost respect and compassion that you possibly can. You have to be sympathetic at times. Many times we don't understand the difficulties and situations that residents and patients are going through in the hospital and the long-term care. So by being sympathetic, Sometimes you have to share, right, their emotions, their losses, whatever it is that they're going through. It's difficult, okay, but we have to show some sympathy towards them at times. Remember to have good tact. Being tactful means that you know when to speak, when you need to stop speaking, right? Perhaps you are tempted to speak unfavorably or bad about some specific religion or specific people, okay? Please stop yourself, okay, and show tact, okay? Do not speak more than what you should, okay? Do your utmost best every single time you work. Look to do your best every single time. That is being conscientious. If you come in here and you do your job, you give it your best every single day, you are being conscientious, and for that you will be commended. Someone is watching, okay? So remember that. Maybe a family member, maybe another resident, another patient, another employee. So your acts, right, your jobs, your efforts will be noted. All right, now certain points about being professional. Provide personal centered care we discussed earlier, okay? Every resident is different, therefore you must provide specific care for them. Be positive for them. There is no better thing than to be positive with residents, especially if they are in a very serious, perhaps life or death situation. Remain positive at all times. Share only positive things with them. Keep residents' information confidential. That is being part of being professional, okay? We cannot go out there and share information to someone that they might know. Maybe it's another family member. Remember, they're not entitled. They're not participating in the care of the resident, so they're not entitled to that information, all right? Be polite and cheerful at all times. I'm not saying try to be someone that you're not, but be polite and cheerful. I think we can all do that pretty easily. Don't discuss your personal problems. Again, that is a violation of some of the policies in place. Do not use personal phones. Nowadays, it's very commonplace for us to carry our phones in our back pocket, and every time you hear a little chime, a little ring, you're tempted to pick it up. Do not use your cell phones during personal care or during care of the residents or the patients. I think it is a very rude, very unprofessional to do that. So refrain that. No one is telling you not to use your phone, but not in the patient areas, all right? Of course, do not use profanity. That is against the policies. Listen to the residents. Please listen to the residents. Many times we are such in a hurry. We're doing things for them, and they see us. They can read your body language. If they say you're in a hurry, that means that you don't have time to listen to them. So please do not show that hurried attitude, okay? Don't show your frustration, even if you are frustrated. Maybe you were short-handed that day and you are upset because someone didn't come in. Please avoid showing your frustration, okay? Because residents can see it in your body language, and they will be hesitant to ask you any questions or concerns they might have. Call the residents by their proper names. Sometimes residents will allow you to call you another name, except it is acceptable if they are okay with it. But avoid names such as grandpa or grandma or granny or honey or anything like that. Those kind of names are inappropriate unless they are respectful and the resident is agreeing with it. Follow proper practices. Again, you should follow the care plan, okay? Explain the procedures before you are doing it. You must always identify yourself, okay? Tell them your name and what you are there to do. The resident has the right to refuse the care, okay? So if you just go in there and start doing things because you're in a hurry and you need to get things done, that may not sit well with the resident, and they may plain out refuse, all right? So please explain things as every time you're working with the residents. Be a good worker, okay? That means completing your task. If you are given 10 things to do during your 8-hour shift or 12-hour shift, whatever it may be, please work in a timely, efficient manner. That means that you need to plan your day, okay? So when you start working, develop a time management routine. For example, you want to do task 1, 2, 3 by 10 a.m. You want to do D, E, and F by 12 noon, and so on. So plan your tasks accordingly. learn a routine that works best for you and your style, and go with it. All right, as long as you don't shortchange the residents for their care. After you're done with your care, as we mentioned before, document. Right, document whatever you did for the residents and report any abnormal problems that you noticed. Okay, it is very important. Reporting problems is critical for resident care, and report them to your immediate supervisor. That is part of your job description, observing and reporting any abnormal problems. Report anything that interferes with your duties, either irresident behavior or faulty equipment or lack of equipment, etc. Please report this right away. Ask questions. If you do not know how to operate a machine, a device, or transfer a patient, or work with a certain resident, you must ask, okay? Do not assume that the resident is able to do things that may not. You might think that the resident can help you to stand and transfer, when in reality the patient perhaps requires a two-person transfer, or maybe even a Hoyer lift device, a mechanical lift device, to transfer them to a chair. So ask before you act if you are not aware of it, okay? Take directions and feedback positively. When your supervisors give you feedback, that means they want to help you. So please be open to it. Do not get upset or offended by the feedback that you're being given. Okay? Be clean and neatly dressed every time you come into work. All right? That is a policy. If your employer tells you that you must wear a certain color of uniform, for females, your hair must be in a bun or in a ponytail, etc. Please adhere to this policy. It is important that you adhere to the policies that your facility gives you. Be on time, not right at the clock in time, but you have to preferably be there 15 minutes till your clock in time. That gives you enough time to walk to your unit and even get report from the personnel that is going off shift. So when you come in, you make your rounds and look at the residents to make sure that the previous employee has completed their duties, right? So that is also a common problem that we see. Sometimes you walk into a situation where there's a lot of things to do as soon as you begin because they were not done by the previous shift. So make sure that you are there on time. Participate in education programs. Now with technology, a lot of programs that are available online on your computer, your employers are asking you to complete those at your own time. So you will log into the website or link they give you, and you would complete those educational programs. Most of the time, these are short courses, few minutes long, that are related to the care of older residents. Okay, so that's another part of your job. Again, be positive role model for the facility by showing good professionalism, being a professional at all times. Your residents will appreciate it. Okay, so we are done with this section. We'll be seeing you in the next section as we discuss more about a little bit of legal and ethical issues that might come up during your care. So hang in there and we'll be right back with you.